We're now going to cover Care Compass. So, Care Compass is the essential dashboard nurses should use when caring for patients in a bay. Ensure you're using Care Compass as your main view opposed to picking up patients from a patient list, as Care Compass provides key information regarding the patient's care that would otherwise be missed. So, we're already on Care Compass. And as you can see, I've already established my relationships with most of my patients. However, our test patient Emma here, you can see is grayed out and it says we have no relationship exists with them yet. So to establish the relationship, up at the top here, you select establish relationship. And once you've established the relationship, the patient's data will then be visible. The relationship will remain for 24 hours, meaning that any notification that fires for the patient you will see. The rule also applies if you open the patient's record. So for training purposes, I won't be establishing this relationship, but you would just drop down your relationship and select nurse access role and then select establish. However, I'm just going to select cancel. And then once you've done that, it will then look the same as the other patients on your Care Compass. So you'll be able to view your patient's activities and tasks that are outstanding. Patient lists can also be created and made active from the Care Compass view by selecting the list maintenance. So if a user has multiple patient lists, these can be viewed by selecting the patient list dropdown. So I'm just going to cancel this. We can also see at the bottom of our screen, we've got our activity timeline. So this shows the activities due based on the patients on your list. The time frame is a 12 rolling. The time frame is a rolling 12-hour clock, so you can always see the real-time view. Overdue items are in red, and activities due later create a green bar. The height of the bar depends on the amount of activities, and clicking on the bar will show activities due, and the activities can also be accessed from here. The activity timeline gives you an idea of how busy your shift might be, but you must remember this only shows scheduled activities and does not cover everything that you do. Whilst the timeline provides a snapshot of tasks for all patients, we will now look at the activities for an individual patient and learn how to complete tasks using Care Compass. So if we, in our activities column, select activities, and then here you can see the outstanding activities on your patient, and you've also got your tabs up here. So you've got your scheduled and unscheduled, PRN and continuous, plans of care, and your patient information. You can also see your patient's details in the blue banner bar. And we've also got these icons here. So if you hover over them, you can see what they are. And you can also filter to see the next 2 hours, 4 hours, or 12 hours of activities. And then to close this view, you just select the blue cross here.